Hello and welcome to another amazing event with Dr. Kam Yuen DZ. Today, Dr. Yuen will take your requests live, and he is here with us. Hello, Dr. Yuen.
Hello. It is not that amazing. It is ordinary. Okay.
No, it's not.
So everyone should be doing it. Thank you for the introduction.
Okay, so for those of you who doesn't know about the Yuen method, this is your opportunity because you have the opportunity to present your request to Dr. Yuen. We only ask you to be brief in your requests, and you can present requests about health, finances, any aspect of your lives. Okay, do you want to start taking requests already?
I just want people to know that when we use less of our mind and into our spirit and just get into the experience that we have a computer inside of us, that we could actually solve any problem that couldn't be resolved, is that we just don't know everything about it yet. And once we know it, it will resolve on their own. And so we have people that have lists of requests, so you could look at that list, and also we want people to know that injury could be resolved very quickly, especially chronic injury if they have it for a while. Those injuries are easier to resolve than the acute. And the acute the acute injuries could be resolved, but it would take an extra few steps, but it's only a few seconds, extra few steps. So we could look at the list that some people have requested that have not been a patient or client of mine.
Mm.
Okay, so I look at the list, and we could start with the list, and then we could get into anything that anyone want to bring up.
Mm. We have a person that she has never been your patient, and she had severe injuries from car accidents.
Okay, so how long that injury happened?
Elizabeth, can you hear me?
Yes, can you hear me?
Yes, we hear you perfectly.
Ni hao, Dr. Kam Yuen. My name is Elizabeth Inganamort, and I have two very bad accidents. One in 2014 on the left side on the red light. She ran on a red light. On 2019.
Okay, but it is important that you be brief. Just let us know
okay.
How long ago.
Don't need to hit. So you got two accidents. Just tell me where it's hurting you right now from.
My right side, lower back, and my neck, and I also got a PTSD.
Okay.
So,
well, you think you have PTSD, but it doesn't indicate that you have that. Of course, you think that even with these so-called accidents, you did not resolve some karma you owe to other people. Okay. So now, what part of your body hurts the most at this moment?
Both sides is my neck in the middle, and then my right side on the right side.
Okay, so how long that been happening?
1 year, and
so
2019.
For a year, and you have seen therapist and doctor about it?
Yes, I still have my case, with the doctors. They put cortisone shots and they put me to sleep. I think I got 4 in my neck and 4 in my back, but only last a couple months and then it went back to the normal pain,
Okay,
like
so
number 10.
right now you have symptoms there, right?
Yes, very bad.
Okay, so even though it's indicated from the neck, but it's really coming from your whole spine and even
Yeah.
coming from your colon and as well as your um, digestive system. So those are the things that you identify to be the cause. So you will just process that, and the effect on you is really a million percent of you. So it's not just 100%. So once you identify those numbers, your physical intelligence will just resolve it as a computer resolve a problem. So now that's been processed. Now, how's your neck in comparison? Seem like it's the same or different?
A little different, yeah, and I just crack it.
Okay, it's no
It just
different.
cracked.
You go see a chiropractor or you just go see medical people?
I just go for the injection, and they cannot put it now because it's already so many injections. But
Yeah, okay.
I don't go to
Well,
chiropractic
the
now.
thing is that your vertebrae is out of place,
Yeah.
but it's really the lumbar more than the cervical, even though you have the symptom in the cervical region. So if you yourself know where it's coming from, it resolves itself. So that's in the process now. Now, how's your neck seem like to you?
Little lighter, little less.
Okay, so what you need to do is you want to tense your neck and make sure that and untense it and make sure there's no discomfort when you do that.
I feel discomfort when I do that on the center of my neck, like
Okay,
when I
so when
tense.
you tense it, that's discomfort, right?
Yeah.
So you want to ensure that tensing and untensing would be normal. Right now, it's not normal.
No.
Right now, you're actually relaxing many times more than tensing.
Okay.
Okay, now tense it again and see what that seemed like.
Less, less pain.
It's like, you relax your neck, it's like your neck can't even hold up your head, right? So
Yeah.
you have the tension and relaxation. So that's pretty much engineering and physiology, right? So, okay, so that's an improvement, right?
Yes. Yes.
So you want more improvement, you have to, come to our event, okay?
Yes. Yes.
And, and learn how to do it or get some regular treatment like this that it resolve everything in your body and resolve other things in your life too, okay?
Yes.
So we just want you to experience it if you never experienced it, okay? So that
I
feels pretty
did. Yeah.
good, right? And
Uh-huh.
it's not shocking or anything, right?
No.
Okay.
It's
So it's a natural thing, okay? So we keep you on our list. If we don't have your email, give us
uh-huh.
your email, then we could give you some other things you could do for yourself, okay?
Okay. You want me send it to the YouTube or?
I don't know YouTube text or not. Go to the UN method
Uh-huh.
and or contact us at the UN method or contact this program. How you got this notice, right?
Yes. Yeah.
Okay, so we'd like to keep in touch with you and get you better and be normal and be better than normal, okay?
Yes, I want to, and I
Okay,
will
so
contact
we're
you.
gonna go to someone else
Okay.
and
Thank you.
injuries, when we could resolve injuries, that means we know how to resolve a lot of things in life. So when people could not resolve injuries, then something's missing, and they just try to excuse themselves for not knowing, right? So everyone could know how to do this, and it's just like using a phone and computer. But of course, need some direction, more so than, well, computer. Sometimes it takes some time, but it's better that there's some direction, strengthen you to have more physical insight to know what's going on. Okay, so I'm going to take another person now.
Okay, Michelle, can you hear me?
Yes, can you hear me?
Yes.
Yeah, perfect.
Where are you calling from, please?
I'm calling from Edmonton, Alberta, Canada.
Okay,
Oh, Canadian. Okay.
you can
So,
present your request to Dr. Yuen. Thank you.
Hi, Dr. Yuen.
hi.
I haven't used this method before, so it's interesting to me. The problem I'm having is sleeping at night is very broken for the last few weeks, and I can't get a good night's sleep.
Okay. Since that we cannot be in your room and watch you, whether you're sleeping or not, and do something, I would ask you, when you think about your trouble sleeping, it kind of disturb you mentally and even spiritually, more so than physically, even though you think it's a physical problem, or we always think it's a physical problem. But so are you disturbed about not able to sleep? And how long has that been going on?
It goes in patterns. I will sleep good
No, I
for
mean,
months and
how long, in years or months?
oh, a couple years,
Okay, so
but it comes in
that's not
waves.
too long. We have people that have difficulty sleeping for like 30 years, right? So
No, no.
actually, the longer they have it, it's easier to resolve it. So,
Okay.
so when you think about not sleeping or having problems sleeping, it kind of disturbs you mentally about it, right?
Yes.
Okay, so we have to resolve that, right? So the mind have the thinking, have the emotion, but in your case, your mind has the reaction. So you don't want reaction in your mind. You want to have least amount of reaction in your mind. So reaction should be totally physical, and your body should have least amount of emotions. So you don't have emotion in your body, but you have a reaction in your mind. So, and then it kind of disturbs your spirit. So we have to take those things in consideration now, okay?
Okay.
Now, that's been processed. Now, when you think about not able to sleep, in comparison, does it still bother you the same way as before?
Not as much. No.
You're more blank about it, right?
Yes.
So if it disturbs you, it keep you awake, right?
Mm-hmm.
So this way, you what we call neutral about it, that it doesn't bother you one way or the other, right?
Okay.
That you fall asleep fine. If you don't, there'll be another night, right? But again, you don't have any mental reaction to
Okay.
not able to sleep, and
Okay.
uh, and you also have a disturbance in your house, inside your house, not so much your bedroom, but when you think about the layout of your house, or when your house is not ideal the way you want it to be, it kind of bothers you, right? Even though you may have a house that's ideal now, but if you have a imperfect house, it like chaos or things all over the place, that would bother you, right?
Yes.
Okay, so let's make it so it doesn't bother you. I mean, is your house in good order?
Somewhat.
Okay, all right. So let's make it so it doesn't bother you. Then it doesn't take any effort or time for you to get it to be perfect. Okay.
Okay.
Now again, there's different things that bothers you, and there's unevenness that bothers you, and then it bothers you 1,000 times of you. So it's not just 100%, it's really 1,000%. So once you recognize those numbers, your internal computer or your physical intelligence will just process that. That's what's not recognized, um, from everyone in the world, right? So otherwise, we could resolve problems and not just arguing about it, right?
Right.
Now when you think about your house now in not in good organized fashion, now what does that seem like? Does it still bother you the same way?
No.
Okay, good. So your internal computer resolve your problem, right? I'm just directing you to do that, right?
Okay.
So thank you for being part of it, and you could write up comments if you like, and we would answer you, okay?
Sure. Thank you very much.
Again, give us your email, so we'll give you some other input, not try to sell you anything, but if you want to purchase something, that's okay, that we keep other people working.
Okay. Yep.
Okay, thank you.
Thank you very
Okay,
Okay,
Miriam?
we have another person, Karim. Can you hear me?
Yeah, yes.
Okay.
Okay. Where are you from, please?
I'm from Russia.
Okay, you can present your request to Dr. Yuen.
I'm sorry.
You can present your request to Dr. Yuen.
Yes, I would like to work on my strength and also sadness.
You say strength, you mean like you perceive yourself having weaknesses
Yes,
and also sadness, right?
yes.
So those two things you brought up is really part of 50 different things, okay? So instead of complaining about 50 things, you will complain about two things, to yourself, right? So we're going to resolve those 48 things along with the two things you brought up, okay?
Thank you.
And your computer would resolve it without voice what it is, right? It doesn't have to tell you what it is or describe it in detail. It's just a 1 and 0 that if you want to know, you could know. But then the sadness is comes up first. So the sadness is would be more coming from your family, your parents and not so much your ancestors, but when you think about your parents and siblings, does it come up a sadness for you?
Parents, yes.
Okay, so we want to resolve that, okay? And without talking to them, right?
Yeah.
So your mom and dad should be even with each other, and other family members should be even with each other. The effect on you is the main percent of you. So we would process that down to 0 minus infinity and beyond minus infinity. And that's how your computer could do that. Okay, now think about your sadness of your parents again now. What did that seem like to you?
I'm sorry.
And when you think about your parents now, how's the sadness? Is it the same or different?
It's about the same. It's about the same.
Okay. When you say the same, then we have to take a few steps further, okay?
Yeah.
So things have changed, but different, not different. You're not able to tell difference or not different. So this process will strengthen you to know different, not different, and changing, not changing, and also get your mind from thinking about your sadness. The sadness should be handled by your physical intelligence. And now, how's the sadness in comparison? Is it the same amount or is it different?
It's different.
Okay, so it's less, right?
Yes.
So you feel you're not as strong you ought to be, right?
Right.
So what do you want to do? You want to be a weightlifter or be an athlete or?
I just want lots of energy, and I just
Okay.
want to be Yeah,
All right,
lots of
just feel
energy
you
and
ought to be, right? So
yeah.
it's not like any special sport that you want to excel in, right?
No, no.
Well, we could do that too for people, you know? So now when you think about your weakness, it actually weakened you, but actually it's just the opposite. See, when the moment you perceive yourself being strong, in your case, you bring up a million thoughts and experience of being weak, okay?
Yeah,
So you don't even want to be strong because every time you think about being strong or act to be strong, it bring up a million weaknesses for you. So it makes you not strong at all, right? So we have to resolve that, right? That's your unique configuration because everybody else would have a different causes and effect.
right.
So if you recognize that, we will process that. Now, how's your question about not being strong? You still have the same question and problem with it?
I feel different. Yes.
Yeah, you're more quiet about it, right?
Yeah. Yes, that's
So
right.
get that out of the way because the moment you feel strong, it bring up a million thoughts and experience of not being strong, right? So that you don't even want to be strong because it weakens you so much, right? So
Right.
this is your, as I said, this is your MO, so to speak.
Yeah.
Uh,
I just still feel kind of confused with all that, and I would
so
like to have some help.
let's get you out of confusion, okay?
Yeah.
Now, you're not confused at all, but when you're not confused, you bring up your spirit being confused, okay? So
Yeah.
let's remove that because when you're not confused, you bring up a billion confusion in your spirit. So once you recognize those numbers, it will automatically resolve it, okay? That's
Okay.
why this is a continual process. It's not a, you do one thing, everything in your life changes. Well, it could change, but of course, you want to do follow-up to perfect it more, even more, right? So how's your
Right.
confusion?
It's better. Yes, it's
Okay.
better.
Well, that's what it's all about, right? It's all about getting better, right?
Yes. Yes. Thank you so much.
Okay, well, thank you for calling from Russia, okay? And
You're very welcome
I do have students and clients in Russia.
as well. That's
Yeah.
wonderful.
I mean, we should go in there and open up. Well, not open up, but let them evaluate. In fact, there's a lot of Russian Americans that actually challenged me that I couldn't do what I could do, and I showed them that I did it when
Yes.
I went up to Northern California, where there's a big community of Russians in Berkeley, California.
Oh, yeah. That's so wonderful. Yeah. There is a big community.
Yeah, so that I gave them a demonstration, and of course they're not impressed, right? So that's okay. I don't
Yes.
want people to be impressed anyway, because it's not as amazing, right? It's all another thing, right? So
Yeah.
thank you.
Yeah.
Thanks for calling in.
Yeah. Thank you.
So as a computer, um, if you are using your computer, you would get 100%, right? In your solution to whatever a problem that's brought up, or questions that need to be answered. So there's nothing mystical about it, right? So if you don't, then what good is your computer, right? The computer needs to be have a glitch in it, right? So um, we should be able to answer any question anyone bring up, and without even verbalizing it, right? So our time it doesn't need to be verbalized, um, or the person gets better before they got the translation, what's been done, and it could be done for a whole group, not just one individual, right? So eventually, we should through the whole community and the city and the country, right? So, and it could be done, right? So that's why Donald Trump gonna lose the election, right? Okay, all right. So let's get someone else.
Okay. Ger or Ger, can you hear me?
Hi, yeah, my name is Gerardo, actually.
Ah, Gerardo. Okay. You can ask your request to Dr. Yuen. Thank you.
Where you from? Or?
Thank you. I am from Mexico, but I'm calling from New Jersey.
Okay, well, perfect English, better than mine, right? So,
Thank you.
okay.
So the reason I'm calling is because I was told maybe 2 years ago I have two inguinal hernias, and I lift weights, but they don't know what's the cause for that.
Well, you got a hernia, you got a high heels hernia or hernia in the genital region or what?
Yeah, in the groin area
Okay.
on both sides.
So the groin area, I mean, do you wear a supporter?
Sometimes when I work out, yeah.
Yeah, well, you have to wear all the time because it's easy for the testicle, put a strain on your testicle. So I know that. I have a direct experience of that, right? So
Okay.
I used to run a lot, and of course, when you run in college, they give you a clean supporter, right? So when I'm no longer in college, well, you know, I just wear my sweatpants without even underwear, and pretty soon I feel a strain there myself, right? But do you feel any sensation there, or you just kind of concerned about it?
Sometimes I feel a little bit of pressure and sometimes a little bit of pain.
But you don't have any symptom there now, right?
No, not really.
Okay, so again, if you don't have any symptom with it, then you have to connect with your mind when you have it, right? So when you have the symptom, your mind is giving you some emotion about it, right, or reaction to it, right?
Yeah, when I feel like I'm pressed, yeah, it gives me some emotional reaction.
Yeah, so you want to remove that, okay? Because a
Mhm.
lot of times you think the emotion is going to make you perform better, but it does to a certain extent, but then it could injure you so much easier.
Okay.
So, but the bottom line is that when you have the experience, you can relate how it troubles you, right?
Yeah.
And you can state what it troubles you, but you don't have to, okay? So
Yeah.
it's really borderline from the mind to the spirit. So your spirit is really affecting, I mean, your mind is affecting your spirit. So that's why a lot of people's mental disorders come from the spirit and it's not recognized. So people think that to get on a spiritual level, you know, you have to go to church or something, right? Or get a spiritual teacher. But in reality, they have to be able to make a distinction between the two where it's coming from. So physically, even though you have physical symptom, but it's all come from a non-physical cause. Okay, so in this case, would be your spirit, and then you have to get it out of your spirit, right? And your mind, psyching out your spirit. So, so that's been processed. Now think about having the symptom now. Does it still affect you the same way?
No, it feels better.
Right. So you know you got better, right? I don't need to say you got better, right? And convince you, right?
Yeah.
So you don't need to be convinced, right? You
No.
know yourself, right?
Yeah.
That's really a good thing that you know yourself, right? You don't need someone to prep you, right?
Yeah, no. So
Okay.
I should stop wearing the support, or should I continue using the belt?
Say that again about the supporter, or
Yeah.
you wearing something.
Yeah, only for lifting weights. Should I continue wearing it?
Well, it becomes stronger, but a supporter would keep the testicle from hanging, and but you could strengthen the testicle, but if you keep on lifting weights or doing strenuous things to your body, it would be a good idea to have a supporter. That's why all athletes have supporters, right?
Okay, but it's not quite there on the testicle. It's higher up in the groin. It doesn't go through the canal that leads into the scrotum. It's in the groin. Yeah.
So you're talking about
Inguinal
muscle in your groin area, right?
Yeah.
Okay, but a support is still going to make it easier for you. But now that you brought that up, again, you don't have any symptoms of it, right? When you do have symptoms of it, it's troubling.
Yeah, sometimes there's a little bit of pain.
Okay,
Just
so
random.
the thing is that I'm just going to say it's sexual, but I don't have to describe it, okay? So I would just strengthen that some sexual experiences, okay? And you're not going to be weakened mentally and spiritually about it. Okay, how about now when you think about having the symptoms now? Does it still affect you?
No, it feels better.
Okay, so you will have less chance of having the symptoms, right? In fact, no chance of it, right? If you continue to ensure that you don't have any weakening effect that have nothing to do with your physical body in that region, okay?
Okay, perfect. Thank you.
So thank you for calling, and thank you for be open to yourself for a new way of doing things, right?
Yeah. Thank you. I appreciate it.
All right, appreciate you being here. All right, anyone else want to experience the
Yes.
change?
Yes, we have another person that never had a consultation with you. Carlos, can you hear me?
Yes. Hi, Dr.Yuen.
Hi, Carlos.
I'm Carlos. I'm from Mexico, but I live in Calgary, Alberta, in Canada.
Okay.
So I have been learning the Yuen method since May, but I have been having trouble on feeling the answers or the intuition.
You learn it directly from us, or you learn it from someone else?
Someone else.
Okay.
And it's just like I feel like sometimes it takes too long. I want to do it perfect, and also that frustrates me a lot. So
a lot of times when you go to someone else that never kept up with the update, it's just like having an old computer that has never been updated. Okay. So so you have the question about not getting everything you want out of the method, right?
Well, I'm having trouble more with intuition and feeling the my body to get the.
I mean, what's your challenge? Well, I shouldn't say challenge. I mean, what's your question about doing the U method from someone else? That you still have question about it, right?
Well, it's mostly to get my intuition out of me. Like,
okay, so it's really the question that the teacher should be able to answer all the question you have, so you have no question, right? So if you have a question about what you do, then what you do will become more difficult, right? You got to be not have any questions. All your questions would be answered, even though it may not be completely answered, but you should not have the question when you try to use this method, okay?
yes.
All right, now, the thing is that your teacher did not answer your question, okay? And so there's like,
I would say that
there's like 1,000 questions that have not been answered, okay? and
Okay.
and they're confusing each other, and make it kind of not balanced and stabilized, and so you're all over the place, and the effect is beyond infinite. So I will just do that for you. Now, how's your question about your capability?
Intuition, like
You still
and
have a question
feel
about
my
intuition?
yes.
Okay. So even though you say so, but that's not it, okay? Your question is, okay, it's because there's a deficiency of intuition and it's not you, okay? So now, how's your question about your intuition?
Like
Any
I would
questions?
like to get more answers, like see
No,
the
well, you're adding more things to it.
method this
Let's
year.
answer intuition first, okay? Do you
Mhm.
still question about intuition in general?
Yes, I would like more, like be able
Well, the thing is that intuition
to get
itself is not
answers
a problem, but you want to have more things that that has to have to process to be more even with each other, because everything you bring up, you're just confused by the multitude of problems. You got anytime you bring a problem up, you have a 50 different problems you're dealing with, and you're not recognizing that. Okay, so now, but when it's just intuition, there should be no question about it, because your intuition is there. You just have you're not able to process it because you got a teacher that probably not even certified by me. So, well, I don't want to go further with it. Okay. So, thank you for for being here. That your intuition is already taken care of.
Okay, thank you
Okay,
so much.
thank you. Thank you.
Okay. Now, let's get someone to have more serious problems, right?
Okay. Anybody with serious problems? Can you write please on the chat?
Well, you could look at the list that if they are present in this call, you could look at the list and call some of them.
Yes, I look at it, but they are not here.
Okay, all right, they're not here, then it's okay. We get people that who show up, right?
Okay, we're going to take Shirley. One moment. Oh no, she's not here. There was a person that was asking about cancer, but it's not here anymore.
Okay.
Um,
Well, she might come back.
yeah, probably. Okay, we are going to take Patricia. Let me see if I can get you. Patricia's not here also. Okay. Anybody with serious problems, it can be finances or health, only in English, please. Okay, what happens to your lungs? JC, let's see. Yeah, JC, can you hear me?
Hi, how are you? Yes, I can hear you.
Yeah, where are you calling from?
I'm calling from Minnesota.
Okay, please present your request to Dr. Yuen. Thank you.
Hi, Dr.Yuen. I have two problems. One is with my lungs. In all the mornings and during the day, I have a lot of phlegm. In in my lungs since long time ago, and cough since long time ago too, like for more than a year.
Okay. So, I mean, you have mucus right now, right, in your throat?
Yes, yes.
And what about your nose? You have anything there?
No, no, only by my mouth while coughing, but
Okay.
not yeah.
With the corona, people kind of suspect you to have it, right?
Yes, yes, but I don't. Unfortunately, I don't have it.
Well, I mean, they suspect you to have it. So they
Yes.
suspect everyone to have it. They cough and have mucus. Well, anyway, you have some of the mucus there, right?
Yes.
So instead of things coming up, I mean, instead of things going down, it came up for you, and it's really dealt with by other people's anxiety and stress because of the corona. So they bring things up from the colon. So your colon is not as good as it ought to be because your colon has opening there, or small opening of the colon that kind of leak out and weaken your other system. So weaken your respiratory system and weaken the rest of your digestive system, and as well as the eliminating system first, and then digestive system. So it's coming up instead of going down and out in at the descending colon, the rectal and anal region. So now, how's the phlegm and mucus in your throat seem like to you in comparison?
50% less.
Okay, well, that's good. Now, the other 50% is people in your family, okay? So, do you have any overly concern for them? Yes or no?
Yes.
Okay. So, so you have concern for them, right?
Right.
And so having concern may make you seem like a better person than if you have no concern, right?
That's
But
correct.
the concern actually make them worse and make you worse too, okay? So let's ensure your immediate family are not that much different than you and not that much uneven with you. And the effect in the family is a million times, that's 100,000 times more than 100%. So now that's process. Now, how's the other 50% seem like to you?
Much better, Dr. Yuen. Much
Okay.
better.
So we can all do this, okay? So it's time for people to process and learn it, but not learning and memorizing it, okay? It's not a regular school that you have to put time in. You just have to be adjusted to resonate on the same frequency as your physical intelligence. And when you use your physical intelligence, you're actually able to remember everything that you've been exposed to, even when you're not exposed to, because you connect with the answer that's around the planet and also outside the planet, right? So you could reach out, just like all these people that write songs and things like that. It's come from the outer universe, right? So, and you connect with that, and it connect with you, and then you have the answers that you're not stopping yourself from having it. Okay.
Okay.
So
Okay.
you have improvement, right?
Yes, it's only like a 10-20% in my left lung only. My right lung, I feel better.
Okay.
It's
So
just my left lung.
it's not your lungs. It's it's really your ascending colon now. Okay. So
Okay.
your ascending colon actually it has some leaks in there, and that's why you should keep in touch with us, and we could recommend a product for you to
Okay.
keep working for you and as well as for your family members. Okay.
Okay. Okay. Got you.
It's not my product, it's a product that I discovered that that kind of assists me in my job, right? So I don't have to repeat myself as
Okay.
often as I want to. Okay. So anyway,
Okay.
so how's that seem like?
Very good. Thank you very much, Dr. Yuen. Thank you very much.
So the left side's better, right?
Yeah, better.
It's not what you think it is, right? So, and it's time for people to know what it is instead of, haphazardly get to the answer that the answer, if it's the right answer, it would resolve the problem,
Correct.
right? That's like kindergarten principle, right? So
Yeah.
you get the wrong answer, it's just not going to resolve anything, right? You're not going to have teachers give you the wrong answer or doctors, right?
Yes, that's correct.
You say to the experts, if that was the right answer, it will resolve the problem, right?
Always.
Yeah, that's right. So that's what we should be demanding from all the experts, right?
That's
Is
correct, Dr. Yuen.
know that they have a physical intelligence that they could turn on and connect with the right answer. The right answer connect with their physical intelligence. It's easier than going to school. Okay.
As easy as that.
Okay. So thank you.
Thank you very much, Dr. Yuen.
Okay,
All
we
right.
have we have Shirley now.
All right.
Can you speak, Shirley?
Hello,
Hello.
Hello.
Where are you
Hi.
calling from?
I'm calling from Indiana.
Okay,
Okay.
what is your request, please?
I have sores on my skin. They said it was cancer. It was basal cell, and I got rid of 2 of them, but I still have one on my face and my back, and then I have some weird spot on my right hand.
Okay. You got rid of it on your own or medically? Or?
I got rid of it on my own. I made some eggplant and apple cider vinegar stuff and put it on there. Plus, I do this method. I took your classes in the early 2000s, but I haven't been able to clear it.
Early 2000, it would be like ancient history now. Okay. So,
I know.
yeah. Like I say, you have a old computer that have to be updated, and that's how everything will change for you. Okay. So keep in touch with us. You don't have to buy things from us, and unless you want to, right? So when you look at your skin or think about your skin, actually looking at it affects you more than thinking about it. Okay.
Okay, that makes sense because one's on my face.
Okay. So when you look in the mirror and see it, it kind of disturbs you, right?
Yeah.
So when it disturbs you, it will get actually stronger in affecting you, right?
Yeah, probably.
It's not probably. I'm not going to give you no probability, okay?
Yeah.
So
Okay. Yeah.
it's not pointing out to you. It troubles you when you look at it, right?
Yeah, it does.
The first thing is that not suppress it and say, "Well, you're not going to trouble by it," right? But you
Right.
can't talk to yourself like that, right? So you want to be truthfully not bothered, right?
Right.
Now the thing is that looking at the situation and also you kind of trigger other people looking at you, and that reinforce it too. Okay.
Okay.
So let's ensure that people are not going to pay attention to those spots that you have that make it worse for you, and you paying attention to it as well. So there's a mental weakening effect on your physical, in this case, your skin. So now, when you think about looking at your face now, in comparison, does it still trouble you the same way? Or you get neutral about it? Or you have to be neutral about it?
I think it doesn't trouble me quite as much.
Okay, well, that's a good start, right?
Yeah.
So the thing is that when you have your experience with your doctor that give you the diagnosis, what do you think about the doctor?
I didn't like him at
Right.
all.
Okay, so there's some reason for it, okay?
Okay.
So so it comes from your ancestors, you know, kind of done damage to his ancestors' skin, okay?
Okay.
So when you think about your ancestors doing that, it kind of troubles you that you have ancestors like that, right?
Yeah.
So you have to resolve that karma, okay? Now we're going to resolve it, and whether
Okay.
you believe it or not doesn't matter, right? That's the movie that has to change, right? The story
Right.
has to change. So now your ancestor and the doctor's ancestors, and now when you think about your ancestor affecting someone's skin, what's that seem like?
That seems better.
Right, it's like this doctors want to get even with you, even though he doesn't know that, right?
Right.
So instead of giving you things that would support your recovery, it just not, the timing is just not right, okay?
Right.
So as I tell others, you know, give us your email. We send you some things that you could use that would actually guarantee that your face will change, okay?
Okay. So do you
It works on my face, so.
Okay. So do you I'm laid off right now, but do you do any
Well,
continuing?
there's more reason to do something that you don't mind to be laid off, right? That means you have more time to make money, okay?
Okay.
Right, so laying off should not set you out. Okay, so it sets you out, right?
Yeah.
But you feel a limitation by being laid off, right?
Yes.
So that would always get in your way, right?
Yeah, it
So
does.
you will try to change your mind and try to think positive and suppress it. You know, you want to be truthfully not bothered by it, okay? So
Okay.
let's make it that way, okay? So essentially, laying off trouble you, right?
Yes.
Okay, so that's 1,000 differences that are affecting you, and there's 1,000,000 unevenness, and the effect is 1,000% of you. So once you recognize those 1 and 0 numbers and enter in your internal computer, it will just process that for you. Okay. Now, once again, think about your situation about being laid off. Now, what's that seem like?
Okay.
It's different, right?
It feels a little lighter, yeah.
Little lighter, we want it completely lighter, okay?
Okay.
So you're surrounding the city in Indiana, a lot of people feel the way you feel, so we have to change them just for your benefit, okay?
Okay.
And then that part of the country, that, you know, we could change the economy of the country by strengthening the weakness that that you could actually change the energy, the dynamics of feng shui in that place. Okay. Now,
Okay.
now, how do you feel about your situation now?
I I feel a little better about it.
Only a little bit? Come on, you can't be a little pregnant. Okay. Now, let's go further. That it's all or nothing. Okay. I
Okay.
mean, all you have is people. If you exchange that $1 among 1,000,000 people, you have $1 million, right? Of
Okay.
course, you don't want to wait 10 years for that to happen, right?
Right.
So you exchange that $1, even among your family members. You actually, family members seem to be pretty strong with the economy and finances. It's just the people around you.
So
Okay, now what's that seem like?
if my family's strong, why am I not?
Well, I'm saying you're affected by your surroundings, other
Okay.
Indiana people.
Okay.
Okay, they're not affected as much as you have. So now, how's your question about it?
Mike,
I mean, why did it affect you and not affect your family? So there's some karma that need to be resolved about some ancestors that got cheated of their money. Okay, so they didn't have a karma, but they have a negative experience with it. Okay, now what's that seem like?
okay. That feels
Different, right?
different.
Right. So even though you could be in the same family tree, but you could still have different ancestors. Okay.
Ah, okay.
All right. So thanks for reconnecting.
Thank you. Do you do any continuing ed? Do you do any classes for people like us?
I do it for everybody in the world. You know, you bring me the world. So that's what I'm doing right now. I mean, I just want to get people into it, and then I could do other things. It's not about just earning finances because I'm over that already. Okay.
Right,
So I need finances, but I want finances for people who work for me and also for projects that I want to support.
right,
Okay, so you should not even question about the cause because whatever it is, you are worth it, right?
right. Thank you.
Okay, thank you.
Okay, we
All
have
right.
another person. Do you want to take another person, or we should just finish here?
Well, we could take another person, or even two, and then we would finish it. Then we don't want to give people too much, and they don't never want to come back, right? Okay.
Okay. Patricia Rich, can you unmute yourself, please?
Hi, Dr. Yuen.
All right.
My question is, I have lumbar and thoracic pain. It limits my movements, and it's been going on for about a year now. And I just seem to, in the background, seems to be a fear of
Well,
living.
you just give me the symptom. You don't have to give me the reason, okay?
Okay, it's
So
thoracic.
if those are the right reason, as I say earlier, the right answer resolve your problem, right?
Right.
So right now you have the symptoms in your lower back and hip, right? Is that what you're saying?
No, I didn't say hip, but yes, that includes my hip. It's lumbar, thoracic, and hip.
Oh, okay. So I went down instead of gone up, right? So, but the thing is that it's really come from your colon, even though it sounds like I give the same answer to people, but your colon is some doctors call it some leaking colon, right? We all have it, and that's why we have to resolve it this way, and also a remedy that will support it, that you don't have to deal with it again. All right, now, so you got the descending and rectal, anal, and they have to be even with each other, and you have 20, 20 little holes there, okay? So, but it affects you like 80%, so we have to lower the percentage. All right, now, that caused, by your diet and also we don't pay attention to our colon that much. and it catches up with us. Okay, now how's the symptoms you have in your spine now? What's that seem like?
Stand up.
Was that?
I'm standing up. I'm bending over. I touched my toes just fine.
Okay, there's a difference there, right?
Excuse me?
There's a difference there, right?
Yes, there's a big difference. I can do it.
Okay, well, that's why, you know, it's time for us to do things instead of putting the time and effort and expense to, you know, to be treated, right?
Right. X-rays, MRIs, and all that stuff. And it's still chiropractors, and it still didn't work. And I talked to you, and I bent over and turned left to right, and I'm better.
Well, thanks for saying that. So write that in the comment, right? We want more people to know that we're not a bunch of crazies here, right?
I know you're not. Yeah, I can feel it in my lower back, and
Well, you know, I say, give us your email, then we do follow up with you, and if you want to do more follow up with us, then you know there may be some charge for that because I have to pay people who work for me, right? So
I understand.
okay,
Okay.
thank you so much.
Can I ask you one more thing? It's almost like a shadow of fear that I get about living. And I think it's because of the energy of
You think
what's
you
around
have a
me.
fear of living. It doesn't come up as such. You have a confusion about living. So living experiences, you know, we have a lot of teachers that give us all the wrong answers, right? So, I mean, it's not because they purposely do that, but they have to act like they know it, right? When they really don't know it, and they don't want to admit it, right?
Right.
So to know it would be answer your question and resolve your problem, right? Now, how's your fear about living?
Well, it just occurred to me that sometimes these questions
No,
can't
I'm
be
just
answered.
saying, just answer the basic question that you gave me a basic question. I want that to be answered before you give me some more info.
Oh, I see. I think I'm a little scared.
Okay, you think you're still scared, right?
Yeah.
Okay, so when you're not scared, then you think you ought to, okay? So let's resolve that, okay? So you've been trained that being scared gonna keep you safe, right? Now, so let's remove that from your answer to causing other people to be scared, okay? Now, how's your question about being scared?
Well, I think I just felt a little bit of joy in my chest.
But you're different from being scared, right?
Yeah, it's like, yeah.
Okay. Let's answer the direct problem first, right? So that's okay. I'm not chewing you out or anything like that. I just want people to be more direct, right, with themselves.
Yes.
Not
Yeah.
not go off the tangent, right?
Yes,
So
sir.
joy have nothing to do with, you know, being scared, right? Of course, you know, when you don't have being scared, then you find your joy, right?
I don't understand. If I'm being scared, I'll find my joy.
No, I mean, when you get rid of being scared, you will find your joy.
Yes,
It will
exactly.
find you, okay?
That's exactly it. If I could quit being scared, I'd be happy.
Well, you know, get rid of being scared is a simple thing, okay? I do that all the time, but of course, people think that, you know, there's something wrong with me that I could do it, right? But they don't even want to learn it, right? So it's still only like less than 1% of the world's population know the existence of this method, okay?
Okay.
So
I've been following your work since early 2000 as well. Ishana was my teacher.
Who's that?
Ishana Bai.
Oh, she passed away.
Yes, she did.
Yeah. Well, she didn't keep up. She got too many daughters confusing her, you know.
Yes. Yes. Oh my goodness. Thank you. I think I'm going to remember this, this scared moving away and a joy
Well,
peeking
keep
through.
in touch and improve yourself, all the time, right?
Yes. I
It's always
listen to I listen to your podcast, and I appreciate everything that you do and how much you're helping the planet and the world. And
so.
I work on my community and my town and my country and the world.
Okay. All right, sounds good. Thank you.
Thank you so much.
Okay, thank you very much.
So
We have
one more person on the call tonight.
Yeah, we have a last person. Is that okay?
Yeah, next time we were just going to do earlier for people on the East Coast.
Okay. Yeah. Okay. Craig, can you hear me?
Yes, I can.
Okay. Where are you calling from, please?
Calgary, Alberta, Canada.
Okay. And what is your request?
Right. So at least you guys are smart and legalize marijuana, right? So it's not like I smoke it, but cannabis should be legalized. They've been used as medicine for over thousands of years, right? So anyway, that's besides the point. So what could I do for you?
I'm just been experiencing a lot like chronic back pain for a lot of years from a previous injury I had.
It's more stabilized than when it's acute, okay? So now you have symptoms of your back pain at the moment?
Right now I just have a tightness, like a tightness that I feel a pull together from my shoulders to my hips.
It sounds like I give people the right answer, I mean, the same answer, but I could resolve it without getting to the cause of the leaking intestine, okay? So the tightness you perceive also coming from the leaking aspect of your transverse colon. Your descending colon seems to be okay, and your rectal, your anal is okay. So so totally you got 60 tiny little leaks that that in reality it adds up to be like 90% of your problem, okay? So you want to lower that 90% down to 0 minus infinity, beyond minus infinity, and also mend those leaking holes in your colon. I say if you give us your email, then we will send you some information that you can order something that that would do you a lot of good, okay?
Okay.
So now how's the stiffness?
It's not as stiff. As you were talking, I could feel my shoulders start to loosen, my upper back, almost like a releasing.
I straightened what I said I was doing, right? So pluck up the tiny little holes that are leaking in from your gut, right?
Yeah.
Now, when you think about having pain, obviously it troubles you, right?
Right. Yeah, obviously. Yep. Yeah.
So if it troubles you, then you're more inclined to get it, okay?
Right. Yes, it does. Correct. Yeah.
Right. So of course you can't just suppress it, because you suppress it, it troubles you even more, right?
Correct. Yeah. Yep. That's right.
Have ways to try to forget about it and try to overcome it and suppress it, but in reality, if you're truthful to yourself, it bothers you to have the pain, right?
Correct. Yeah.
So now it's not just a back pain, but other pains in life, okay? Now,
yeah.
So we have non-physical pain more than physical pain, even though it manifests physically. So you got non-physical pain from your mind and spirit, and that's like a million times stronger than your physical pain, okay? So let's make everything even with each other, and the effect on you is 1,000%, so it's not super high. So now when you think about physical pain now, does it still trouble you the same way as before?
No.
Okay. Well, that's a new way of dealing with it, right?
Correct.
You don't,
Yep.
right? So when you have physical pain, it doesn't trouble you. Most likely, it will only last for a second or two, right?
Correct. Yep.
If it troubles you, then it could last all day, right? Or even next day.
Yes.
So, but people have to learn how to delete that, right? And,
Right.
it's so simple that you can learn that in less than a minute, okay? Of course,
Okay.
then you have to see the whole picture, how things integrate with each other, okay? So it's not just learning one tiny aspect and then try to teach someone this whole method by knowing a few things, right? So it's really complete, right? So it took me like 40, 50 years to get here, but it doesn't take other people that I taught or have been teaching that long, okay? So,
Okay.
So thank you everyone for your appearance on this program. And,
Thank you.
and it's great that I have a chance for you to experience it, that it should be, the 100% should be expected, right? And the solution should be there. And of course, you could compensate for certain things like wearing the mask and social distance. Those are good, right? So, but you have to get to the point where the virus is not going to come up from the intestines into the mouth, and people think that it's entered from the mouth when it's actually come up from the intestine. Okay, so that's why I would do a public service for free, that anyone's open for resolve the coronavirus. I mean, a lot of people do resolve them, right? Only the people that go in the hospital, in many cases, that they don't quite know what to do with the people that are in the hospital that get them in trouble. Okay, so plus they have to be strengthened to be stronger, to be putting up with the experience of being in the hospital and the procedures. So thank you again for everyone listening in. And if I don't get to you, try again and get on Facebook and give me some comments and share with with people, so they don't think that what I'm doing is crazy, right? So, so any comments from any of my Three Musketeer program that we're gonna have tomorrow in Spanish?
Laura, if you want to say something.
Hi, Dr. Kam.
Hello.
Hi. I'm just having some kind of pain that I can take it in my stomach.
Okay, well, I will just do that offline, okay?
Great.
And, if it's not gone, then you text me.
Yeah, sounds great.
Okay. Because we don't want you to be part of this program. The victim.
I'm very glad, Dr. Kam. Thank you. I'm loving to join every webinar.
Okay. So we should have, short webinars, podcasts. So if anyone, have a useful message, that should be a useful message for everyone in the world, right? So, all right. So thank you for your support, and then I will meet you at your program tomorrow. That starts at 1 p.m. Pacific Standard Time, right?
Thank you very much, Dr. Yuen. For those of you,
I'll be a guest there, and again, we'll pick people who have injuries and resolve injuries, right? So because we resolve injury on the spot, that we know what's going on, right? So thank you.
Thank you very much. For those of you who speak Spanish, we will be live with Dr. Yuen tomorrow again at 1 p.m. Pacific Standard Time. And for those of you who didn't know about the UN method, you can find us on Facebook, the Facebook site Dr. Kam Yuen, and also in unmethod.com and in contact us at unmethod.com. Thank you very much for coming. Thank you very much.
Thank you.